Hello and welcome. I am Joanna Cohn, and as the director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health, I am so thrilled to welcome Dr. Anna Gilmore as today's Innovations in Tobacco Control speaker. Anna Gilmore is Professor of Public Health at the University of Bath and is the founding director of the Tobacco Control Research Group, which now comprises 26 staff, 10 PhD students, and is a leading global center for research on the commercial determinants of health. Anna Gilmore is also co-director and founder of the Center for 21st Century Public Health at the University of Bath. In 2012, her team established the groundbreaking knowledge exchange platform called Tobacco Tactics. In 2018, they became a research partner in STOP, which is a global tobacco industry watchdog. And in 2024, they became a research partner in the UKRI Population Health Improvement Network grant to help address the commercial determinants of health. Now, prior to getting a PhD in public health medicine from the London School of Hygiene and Tropical Medicine, Anna Gilmore received a medical degree and worked as a medical officer in a range of locations, including Nepal and India. And her work has consistently focused on the commercial determinants of health and evaluating the impacts of public policies on health, and has led to substantial policy impacts from the local to the global level. Now, I cannot overstate how groundbreaking, innovative, and critical Anna's research has been over a span of more than 20 years. One hallmark of her research is the keen focus on the vector of the tobacco epidemic, the tobacco industry itself. And her research has examined the many ways tobacco companies have interfered in policy making, including how they influence and use science for their own profits, their transformation agenda, their pricing strategies, their use of international law, their ruse of corporate social responsibility, their use of bribery, and their use of harm reduction narratives. Anna has over 350 publications and is a member of various international and national expert groups, including the World Health Organization's International Expert Group on the Commercial Determinants of Health. She works closely with civil society groups and intergovernmental organizations, including the WHO, the World Bank, and the Secretariat to the Framework Convention on Tobacco Control. And her outstanding research has been recognized through numerous awards, including the WHO World No Tobacco Day Medal, the Public Health Advocacy Institute Award, and the inaugural European Health Leadership Award for her being a pioneering change maker, and a special recognition award from the WHO Director General just in 2021. So we are just so honored to have you here with us today, Anna, and I look forward to hearing what you're ready to share with us. Thanks so much.
Thank you, Joanna, for that very overly kind introduction. I hope I can do it justice, and it seems, oh gosh, somewhat inappropriate in many ways to be giving a talk about the commercial determinants of health on the day the US election results come in, but I think we should move swiftly on. So I'm just going to start with this conflict of interest declaration, just to say that all details of our funding are available online. We don't accept funding from tobacco companies or other commercial actors whose interests are not aligned with improved public health. And you can get all details online. But today, this is what we're talking about. So what I'm going to try and do is assess progress in tobacco control and explore whether it's time for us within tobacco control to learn from this wider emerging agenda on the commercial determinants of health. And before I kick off, I just want to acknowledge Sophie Brasnell for support on the slides, and the many members of my team whose work has contributed to some of the evidence that I'll talk through. So the starting point really is this, that tobacco control is often seen as the poster child of the commercial determinants of health, because enormous progress has been made in advancing tobacco control, in addressing the tobacco epidemic and its commercial vector. And as a result, for many years now, global cigarette consumption has been declining, as has smoking prevalence, while in other areas of public health, we're seeing the opposite pattern. So if we look at rates of obesity globally, since 1990, rates of obesity in adults have doubled. In adolescents, they've quadrupled. And so it's perhaps not surprising that other areas of public health with industry vectors, such as those listed here, are really trying to learn from tobacco control. And we're seeing, many papers now looking to tobacco control to learn lessons from. And whilst there are, of course, lessons to be learned in that direction, the point I want to make today is really, I believe there's lots that we can also learn in tobacco control from these wider debates on the commercial determinants of health. So I want to do 4 things today. I'm going to give a quick background to the commercial determinants of health. I want to take stock of progress in tobacco control, and then examine why progress is stalling. So I've kind of given the game away there. And explore, are we at a tipping point? Do we need to be worried? And then look at where do we go from here? So as background to the commercial determinants of health, I'm going to base what I'm saying now on a series that we published last year in The Lancet, and in particular on the first paper in that series. So if you want to know more, please just look at the Lancet website, and there are the 3 papers as well as some wider support materials. So really interest in the commercial determinants of health has come about because of the enormous scale of commercial harm. And just the 4 products detailed on this slide are estimated through global burden of disease data to cause 19 million deaths a year, or if we add in some other larger estimates, up to 33 million deaths each year. So that's between 1/3 and almost 2/3 of total global deaths, or between 40 and almost 80% of NCD deaths. If I give you a comparison, COVID-19 across 4 years caused 6.9 million deaths, and in a single year, the most deaths was 2 million deaths globally. And yet that led to a massive response, which we've all seen, many of us were part of. But this vast amount of deaths, progress is going very badly in addressing this commercial harm. And in fact, Luke Allen's most recent paper shows that progress in these policy areas is generally going backwards. But the commercial determinants of health actually is far broader than that, because the commercial sector has far wider impacts on health that go beyond just those 4 specific products and other harmful products. And that's due to, for example, the political and economic systems that these commercial actors have helped shape. The diverse practices they engage in, which can also harm health. For example, we've seen a shift over time in labour practices towards more informal and 0 hours contracts, and we now know that those can also harm health. And so commercial actors can impact on health through diverse pathways. And that led to this more focused definition that we gave in the Lancet paper. And we're also trying to highlight here that not only do they impact health, but they also impact equity. If we take labour practices, again, what we're seeing is an exponential increase in chief executive salaries, whilst average worker salaries stagnate. And as more of the labour force moves to the private sector, that obviously has a growing impact on equity. That's just one example. But of course, as these pictures illustrate, the commercial sector is very diverse. And some commercial actors, of course, have positive impacts on health, and some will be essential to moving this agenda forward and finding solutions. And another of the key issues we face is, in fact, some of the small and medium enterprises, which actually make a disproportionately large contribution to inclusive economic growth. They're very often the victims of the same system, because, for example, they don't have the global reach to engage in some of the same practices that the major transnational actors engage in, like tax avoidance, for example. So the point we make in this Lancet paper is that there's been a huge shift in the way that capitalism is organized from a more regulated form of capitalism in the post-war period to a more market-oriented neoliberal form of capitalism since the late 1970s. And this has led to increasingly powerful transnational corporations and created what we call a pathological system in which those commercial actors are increasingly enabled to cause harm, but also externalize the costs of that harm. And so this picture tries to illustrate the system problem to you. And I don't know if I can try and use the pointer here. So you can, if we start at this point here, so this is just signifying that over time we've seen a shift to these more powerful transnational actors. These actors are both able to shape norms. They use their power to shape norms and to shape policy. And norms are really social expectations about how we behave, how organizations behave, how governments behave. Let me give you one example. So we've seen over time when we're trying to address obesity, a shift towards using partnership approaches or what are called multi-stakeholder initiatives. This has become a norm. I can't tell you how many public health conferences I go to and I hear public health people saying, we need the food industry at the table. But if you actually look at the evidence on this, there is no evidence that these approaches, where there is a conflict of interest, for example, between an ultra-processed food company and the actions we need to do to reduce obesity, when there are those conflicts, these multi-stakeholder initiatives don't work. And yet it's become a norm that this is the way forward. And we see these norms being propagated by all sorts of industry allies until they become very well established. So they also use their power to influence policy. We see that all the time in tobacco control, but it's not only public health policies that they influence, it's labour policies, tax policies, and so on. And through this, they're both able to increase their sales and their profits and reduce their costs. And those are the two key ways in which harm is caused. So if the product is damaging to health, tobacco, ultra-processed foods, alcohol, and so on, the harm occurs primarily through increased sales. But for other corporations, it's through reducing costs and trying to maximize profits that we see damage. So the labor practices I was giving you the example of, which have been developed as a way of squeezing cost and maximizing profits. So when these commercial actors cause harm, they don't meet the cost of that harm. And so therefore they are in direct effect of that, making excess profits. And so this cycle on this side continues. Meanwhile, the harm is caused and someone needs to meet the cost of that harm. Generally, this is falling to governments or to the public. And of course, once they've met the cost of that harm, whether that's healthcare costs or cleaning up the oil spill or the chemical leakage into the river, for example, that reduces the resources they have available, for example, for housing, for healthcare, for welfare. And so that harm is compounded. And so the profits are being privatized. We've got the winners on the left, if you like, and the risks and the losses and the costs are being socialized. We have the losers on the right. And so the system continues. This is just a sort of example of some of the things we're seeing in this system. So this is data from the World Inequalities Report. And what it shows is that since around 1980, the share of wealth held by public actors has fallen. And in these high-income countries is now close to zero or negative, whilst the share of wealth in the private sector is increasing such that all of the wealth in these countries, or almost all of the wealth in these countries, is now in private hands. And obviously that's got implications, therefore, for government's ability to address inequity, to address climate change and poor health. And whilst this graph is just for a few countries, I've pulled the data out in other countries, and you do see a very similar pattern, including for low and middle income countries. And let me give you a more specific example of the system problem. And this is work by Ben Wood and colleagues. And this is showing that effective tax rates on the US listed companies in those 4 industries I showed you at the beginning have been falling over time, again, since about the late 1970s. And yet this is a period when harm from those companies has been increasing, other than in more recent period from tobacco. And it's not because there was less wealth in the system, it was because wealth and income, rather than being transferred to governments, were increasingly being transferred to shareholders. Okay, so that's a whistle-stop tour of the commercial determinants of health. So let me move now to trying to assess progress in tobacco control. So we've had now over 75 years of tobacco control and around 30 years of vector research. And we have made good progress. For many years now, global cigarette consumption has been falling, as has smoking prevalence. But if we look more closely, since around 2020, that progress has stalled. And this is an issue really that few are talking about. but we're seeing a similar pattern in smoking prevalence. So this is data from the Global Burden of Disease. And if you look at the second row of graphs here, this is global, Central Europe, high-income countries, Latin America, and so on. Hopefully you can see some of the titles there. And what this data is showing is that the rate of decline in smoking prevalence has stalled in every world region. And in fact, the latest WHO report on the tobacco epidemic, published last year, I think, confirms this slowing in the rate of decline, and predicts that it will continue slowing over time. We're also seeing some worrying trends in youth smoking, and I don't have time to go into this in detail, but this is, I've given examples here of worrying trends in England and Ireland. I saw data last week, I think it was presented on Sweden. I know in Australia they're worried about the youth smoking patterns. And there is some data, for example, in our country to suggest that youth smoking uptake is on the increase. And often these youth smoking data are going to be hidden, or the patterns of youth smoking will be hidden because the numbers of youth can be small within wider data sets. What about policy progress? So this, again, this is from the 2023 report from WHO on the global tobacco epidemic. And the graph here is the number of countries, here in the figures, who have implemented at least one Empower measure at the highest level of achievement. And in the left, I pulled out those data and have looked at the number of additional countries with at least one measure in place. And you can see from in each 2-year period, so 2008 to 2010, 20 countries, 17 countries. But in the last 2 of these periods, we're down to 6 or 5 countries. Okay, so progress in policy implementation also appears to be stalling. So these are clearly worrying trends for all of us. And the concern, of course, is that, are we at a tipping point? Is this just a temporary slowing, and will things continue to progress? Or is it that we're in danger of progress being reversed? So let's try and examine why. My colleague Sophie Brasnell did a quick literature search on this to try and explore why has progress stalled. And I think perhaps the most interesting thing is, firstly, there was almost no literature on this. So if you compare that with the endless papers on e-cigarettes or heated tobacco products or whatever, this almost sort of existential issue for tobacco control has barely been addressed. But when we looked at the papers that had discussed this, the reasons fell into 4 quadrants. So tobacco industry, power, and influence. So the things that, Joanna was mentioning at the beginning, really, industry interference, harm reduction debate, CSR initiatives, introduction of newer products. And then on the other side, within tobacco control, lack of resources and lack of capacity. And then we have reasons that could be put under government. So government concerns about pushback from linked businesses such as retailers, government perception of the tobacco epidemic as done and no longer a priority, concerns about public disapproval, lack of political will. But I think you can see that many of those things can be really linked to industry arguments and industry influence. And then we've got the other. And of course, we've had COVID-19, and that, of course, has led to sort of a focus on that and a focus away from other public health issues. And after COVID-19, it's also led to concern about health versus the economy and the need to sort of move the economy forward. We also looked specifically whether there was any evidence of what you might call policy hardening. So this would be the idea that as more and more countries implement policies, in the remaining countries, it becomes harder to implement policies. But just to be clear, there was no evidence that this was occurring. So let me just tease out some of these issues for you and explore in more detail. So the issue of new products came up. And before we go further, I just want to say, I think the issue is not the new products per se. The issue is the industry and the for-profit motives of the industry, and therefore the way that they use these products. Because genuinely lower risk products that help smokers quit do represent an opportunity. The key issue is, can we harness that opportunity and overcome the ways in which the industry is misusing these products? And the problem is this, that we're up against a hugely powerful industry. So transnational tobacco companies are some of the most profitable companies in the world. And this industry is trying to maximize sales and products from any product. Our evidence also shows, and I'm referring here particularly to this report, Addiction at Any Cost, we did a few years ago, and also a chapter we've recently published in the Royal College of Physicians report, where we pulled together a lot of our evidence and others' evidence, of course. So they've been trying to redefine harm reduction and use it against public health. If you look at harm reduction actually means reducing harm at population level, at community level, and individual level. And what we're seeing here in tobacco, as the graphs are illustrating, is not harm reduction. And when the industry talk about what they call harm reduction, that they're not meaning harm reduction. They're sometimes talking about risk reduction. So they're looking just at the population of smokers and can these products reduce risk in individual smokers, which of course they can. The issue for us is what is happening at population level. But they're using these products and this concept against public health to push against tobacco control measures of proven effectiveness towards measures that we don't know whether they will work at population level, to rehabilitate itself and through that to increase its access and influence, and to replace public health experts as the voice of tobacco control. Simultaneously, of course, to undermine Article 5.3 and split the public health community. But the key issue that I think is being missed in these debates and these papers that really underpins why we're seeing this happen is this. That we have not addressed the wider system problem here. And this is the system problem that I was just detailing for you that explains the commercial determinants of health. And our evidence suggests that, this is a system in which industry, of course, remains incentivized to maximize profits. So if you squeeze profits in one area, if you squeeze profits from cigarettes, just like a balloon, the industry will shift to focus elsewhere. So it's now focusing on other products. And this is a system in which huge power remains with industry. It remains enormously powerful. I've told you already, these are some of the most profitable companies in the world. And there is a huge power balance remaining between the tobacco industry and tobacco control, and even in some countries between the tobacco industry and governments. And I believe that until we address that problem, this system problem, the externalities, the excess profits, the power and the influence, we're only going to get so far because the industry will keep fighting back. And this is really how I got into this wider agenda on the commercial determinants of health. It was really when we were trying to move forward the plain packaging agenda in the UK, which is now in place. But it took 8 years from start to finish to get that one policy implemented. And this is in a country that is highly resourced, where there's very strong advocacy organizations. We had good research. We had research specifically looking at the industry and exposing what they were up to. And it still took 8 years. And it felt to me that that's absolutely unacceptable, that every policy we try and implement, we have this battle and it will take forever. We don't have time to let that happen. And so we also need to address this wider system problem. So what I'm going to try and do now is kind of explore how this system problem is playing out for us in tobacco control. And in many ways, it's obvious. So, of course, as sales of cigarettes got squeezed, the tobacco industry has diversified, and it's now what we call a multi-addiction industry. So we know about the e-cigarettes, the heated tobacco products, the oral nicotine. It's also now investing in cannabis. And we've also seen from some of the transnationals investment in pharmaceuticals. And this graph is really going to try, I hope, and explain how the drive for profits really underpins industry action. So the blue line here is the line I've already shown you, showing how global cigarette sales outside China have been falling until the last few years. And then the orange line is the retail value of cigarettes in real terms. And you can see for this first period, even though global cigarette sales were declining, actually the retail value, which is a proxy of for profitability from these cigarettes, was increasing. And that's because cigarettes are highly addictive. And even if sales are falling, as long as the industry can increase the prices more than sales fall, its profits will continue to increase. And the biggest threat to this is, of course, high tax rates, which is one reason why it really opposes taxation policy. And then you can see from this point that things start to waver in terms of retail value or profitability. And the interesting thing is, this is the point at which the tobacco companies start to invest in e-cigarettes. So if we go back to the 1990s, Philip Morris was actually doing research on what can be considered precursors to e-cigarettes, but it abandoned that research because it thought that these products could present a regulatory risk to the cigarette. And of course, the cigarette remains these tobacco companies' primary and most profitable product. But then e-cigarettes emerged as a competitor to the cigarette, as a competitor to transnational tobacco companies from 2003 in China and then from 2005 in the US market. But the tobacco companies didn't invest until this point when profits started to be threatened. And then we see this sort of scramble, if you like, for the e-cigarette and nicotine market. So the first e-cigarette acquisition in 2012, that was Imperial Tobacco's bought up Blue. Then they start launching their own e-cigarette products. Then Philip Morris launches a heated tobacco product, IQOS. Japan Tobacco also launches one the same year. Then we see Juul. So Juul is a nicotine salt product. That then also led to problems for their market share. And then we see the transnational tobacco companies scrambling and launching nicotine salt products. And then we get nicotine pouches. And so it gets on. But the point I'm trying to make is this is really, this action was a sort of an industry under threat, and again, driven by threats to its profits. But what we see here, and again, this is value, real retail value of global sales of tobacco and non-combustibles. Let me talk you through the lines. So here, blue is cigarettes. This orange is with other combustibles, so cigars, hand-rolled tobacco, pipe tobacco. And you can see these are running pretty much parallel. But once these new products, and here I'm talking about e-cigarettes, nicotine products and so on, we start to see those lines diverge. And so what this is showing is that in terms of value and profits, this is absolutely working for the tobacco industry. These are additive profits, additive value. The reason I'm not presenting sales data is we can't actually get sales data for e-cigarettes because e-cigarettes appear in so many different formats. But actually for products other than cigarettes, when you look at retail value versus sales, the data mirror each other. So this is a proxy, and it's suggesting that at least many of these sales are additive to cigarettes. They're not replacements for cigarettes. In other words, what the industry is up to is absolutely working for industry. So at the same time, we also saw an increase in and refocusing of tobacco industry political activity. So this really, and many of us will remember this, suddenly, the Foundation for a Smoke-Free World is formed with $1 billion in funding. That was 2017, January, the next year, I think that they're taking, December the next year, they're taking out an advert in the UK. This is Philip Morris saying it's giving up cigarettes. Then we have a global campaign about unsmoking our world. They're funding media groups around the world to ensure they get favourable coverage, and managing to host events of the sort they really hadn't been able to host before. And this is quite interesting. So this is in Davos. The tobacco industry is officially excluded from Davos. So what they do is they host events on the periphery in hotels. It gets coverage. And they use The Economist to recruit high-level people to come and speak at their events. So this is a picture of Tony Blair, the ex-British Prime Minister, speaking at an event funded by Philip Morris. And you can see Philip Morris's logo in the background. And so this is a massive investment in renormalizing the industry, harnessing harm reduction to position it as the future of tobacco control. At the same time, the industry was attacking us, and many of us will have experienced that. So just a quick aside to make it absolutely clear that these transformation narratives are entirely false. So we've done one general paper on that where we set some standards for industry transformation and make it absolutely clear that none of the companies are meeting those standards. And this is a more recent paper, and it looks specifically at Philip Morris. And here we've got cigarette shipments and cigarette sales from Euromonitor, because what happened is, I've told you they made their transformational claims in 2016, we're changing, we're now the solution to the epidemic that we've caused. And then in 2019 here, they set some aspirational targets for reducing cigarette shipments. And so we looked at this, and what we found is two things. First of all, the so-called aspirational targets were not aspirational. They were based entirely on this preceding decline. And of course, that preceding decline is attributable to tobacco control, to all of your efforts. And no sooner have they set this aspirational target, but they're not even going to meet it, because what happens is the rate of decline in cigarette sales and shipments stagnates. So this is working for Philip Morris, and this is showing their data rather than the global data. Okay. So let's turn a little bit and look at industry interference. So we realized at around this time that although we had a really good understanding of tobacco industry influence, what we call tobacco industry corporate political activity, we'd done a couple of systematic reviews, and we pulled this together in a model and a taxonomy, which we called the policy dystopia model, which basically tells us in a few actions and arguments what the industry does, and we've shown that it does the same thing again and again across time and place. But we realized that this evidence was focused on the acute policy window, because those were the fights we'd been happening. You know, every time a country X was trying to get a policy through, there was a fight back from the tobacco industry, and that's what the evidence had focused on. But we realized here the industry was doing something different. This was a long-term policy influence game the industry was up to. So we looked at this in two main papers. So Tom Hurd led the first paper, and we used a couple of case studies to look at industry influence over the long term. One was harm reduction. And then in the other piece of work, what we've done is we've looked across health harming industries more widely. So tobacco, alcohol, ultra-processed food, and gambling, to look at how they influence policy in the short and the long term. And so what we found in this was that the industry's long-term policy objectives were these, and this, as I've said, is across the board of these four industries. But it matches exactly with what we've been observing the industry doing, as I mentioned to you at the beginning of this section. So they're trying to normalize themselves as essential policy partners. They're trying to disenfranchise and depower the public health community. And they're trying to reconfigure and constrain public health as non-regulatory and individual focused. Of course, this is an area in which they can make profits, because if we stop doing the regulation and we just shift the whole focus to, you just swap the cigarettes but for our new product, or it's a way in which they can make money. And they also are seeking to and have successfully established regulatory rules that advantage their interests. And this goes back to some previous work that we did. And what we showed is that tobacco companies, working with a whole host of other corporations whose products were damaging to health, put in place in Europe and the UK a system known as better regulation. And they did that specifically to make it harder to pass public health policies. And what those approaches require is early impact assessment with affected stakeholders, particularly business, and trying to assess policies using a form of impact assessment that takes a business-oriented approach. And so it tends to, and what we've shown is actually these approaches do favour powerful corporations, because they provide a route for them to feed in their misleading evidence, their misleading data, and to influence policy. And we know that they have been working to sort of expand those policies around the world. So a couple of years ago, some members of my team were in Zambia when they were trying to move forward a tobacco control policy there. And hey-ho, Japan Tobacco International was trying to put in place exactly this system to make it harder to pass policies. So we're all fighting at the sort of public health policy level, but they're fighting upstream of this, among other things. And then in terms of their actual strategies, so what do they do to influence policy? And we divide our taxonomy, our model of policy influence, into argument strategies and action strategies. So the argument here is different to the acute policy window. And the argument has basically been, we've changed, we're now the solution, you need to work with us. In terms of the action strategies, these are the same as the short term, which makes it easier for us to address. But the difference is that there's just vast resources being thrown at this, and it's really global in nature. So I've given you some examples already of the reputation management efforts, and including the picture at the top there. This is a global image overhaul aimed at fundamentally repositioning the industry. And it happens globally, but of course it's leveraged nationally and locally. So the other change we've seen is coalition management. So as the industry, the first reputation management is a fight. The tobacco industry was denormalized. It's now desperately trying to re-normalize itself. In the meanwhile, it's shifted its influence strategies because of 5.3, doors are increasingly closed to it. It's operating more and more through third parties. And what we're seeing is we're seeing now third parties, or what we call a dark influence web. It's becoming harder to know whether the organizations we're seeing are linked with industry. And at the same time, they're trying to fragment and intimidate us in public health. And then the third key action strategy is information management. And this is around their science. They've put a vast investment in science. Of course, we're seeing huge numbers of industry papers on heated tobacco products, on e-cigarettes. These are very often very poor quality. They're using the same problematic scientific practices as they've used in the past. Our evidence shows that quite clearly. These include, for example, the use of third-party funding through the foundation, or what is now called the Global Alliance to End Smoking. And then a massive public relations effort to amplify their misleading science. We're also seeing them produce a whole host of white papers to try and claim that they're really like government, and to try and assert their authority in science. So here's some work they've been doing. This is Philip Morris again, saying we cannot let misinformation get in the way of progress. And this is from a company that really has driven misinformation from the very beginning. The other thing we found is that the measures that had been put in place so far to protect science are being circumvented. So some of you will know that some journals have chosen to reject tobacco industry funded science, and a lot of journals now, particularly medical journals, require a declaration of funding sources and conflicts of interest. But what we've seen is that even journals with a policy not to take industry-funded science are inadvertently taking such papers, partly because there's third-party funding, partly because the authors don't declare their links. And so those policies are being circumvented. They're also targeting journals where editors have financial links to industry, or they're using their power to pay for a special issue, for example. And then they're self-publishing on preprint platforms. So there's no editorial oversight, there's no peer review, and there's often no mandatory conflict of interest disclosures. So the measures in place so far are being circumvented. And the other more general problem we're seeing, and this relates to the wider agenda on the commercial determinants of health, is that public sector funding of science is stagnating, but private sector funding of science is increasing. Okay. So let's move to our last section. Where do we go from here? And I think we need to do three things. We've got to continue the battle for each policy, because in each of our countries, these policies are not going to move forward unless there are some of us engaged in those debates at national level. But we also need to be aware, as well as those short-term battles, there is this long-term agenda going on. There is this long-term industry influence agenda, and we also need to be cognizant of that. And then thirdly, we also need to address this system problem, including industry power. Just to flag that these, the battles for each policy are generally at national level, and as I've flagged, the industry's long-term influence strategies are global and leveraged locally. Luckily, as I'll try and show you, the ways to address these things are closely linked. So I've talked a lot about power, and this is not just power in an economic sense. So obviously there is power in an economic sense. These are incredibly powerful, well-resourced, profitable companies, but it's also power in an ideational sense. And this is some work again by Ben Woods, there's so much work on power, and he's tried to adapt the thoughts and the philosophy on power to the commercial determinants of health. So he identifies two sources of power that commercials have, the commercial actors has. The second is ideational power. So this is the knowledge that they have that we might not have. So we know in the past, they've had knowledge about addiction way before we had that knowledge. And then it's also their perceived legitimacy, and through that, their ability to shape values and norms, the very things I was showing you at the beginning that they're doing. And then they operationalize this power through three main routes. So what we call instrumental power. So that's direct interaction with and influence over other actors. That's often coming because transfer of funding, so funding political parties, supporting presidential campaigns, funding science, because no one bites the hand that feeds them. So even researchers who have the highest integrity, everyone is affected by those who fund them. And the research on that is clear. And then structural power, this is having impact on the structures where governments and industry interact. So this is the industry, for example, being in the government building, sitting at the policy table, able to shape legislation. And then we've got discursive power. This is to shape other people's interests and ideas, and obviously here particularly interested in governments and policymakers. And what I want to highlight for you is how important Article 5.3 is, how important it is as a means of actually addressing industry power in a way that I think is often overlooked. Because it has rules on conflict of interest. It has rules about getting the industry out of the room. And if the industry is out of the room and the policymakers are no longer meeting with the industry on the golf course, it's far harder for them to shape our thinking, to shape their thinking. And in turn, that helps address their industry power. And I think we can also play a role here because, you know, Mike Daub has argued that we need an Article 5.3 for civil society. And since 1990, the World Conference on Tobacco or Health has excluded anyone linked with the tobacco industry. But there are still medical conferences where the tobacco industry is welcome. There are still professional societies where the tobacco industry and those it funds are welcome. We can actually reduce the power of industry through these soft measures, you know, really implementing Article 5.3 at government level, but also looking within our own sectors, if you like, about how we deal with conflicts of interest and reduce industry power. So the other thing is denormalization. Denormalization, of course, can help address that ideational power, but it's going to be also really key in countering this massive reputation management effort that I've been showing that the industry is engaged in. And we've actually got really strong evidence about the importance of denormalization and what impact it can have. But I think we've forgotten that. We've kind of taken our eye off the ball and forgotten the potential for denormalization as a tobacco control strategy. And again, like Article 5.3, I would say that this is more important than ever. So just to remind you of that evidence, so Ruth Malone and colleagues did a systematic review back in 2011, and they identified a robust body of evidence showing that tobacco industry denormalization is an effective tobacco control intervention at the population level, but it can also help directly erode industry power. And then there's the NCI monograph back in 2008, which had good evidence for mass media campaigns, but again, specifically or particularly including messaging around industry deception. I've talked a bit about science and information management. We really need to do a better job in protecting science. Again, this has indirect impacts in helping us to address industry power as well as its information management strategies. So I've told you that you know, the measures that have been put in place so far around governance of conflicts of interest are important. They do help shift norms a bit, but ultimately they're going to be insufficient for the reasons that we've talked about. But there's one thing we can do here that I think would have more impact, and that is to have a single publicly accessible database of researchers and editors' financial links. This makes it far harder for authors and editors to undermine the conflict of interest policies and make partial declarations. Okay, but longer term, we need to move towards more system change. And I think the key thing here is to reduce industry involvement in science. So we do need research on these new products. We need research on all sorts of issues in tobacco control. But I've already illustrated for you, we've got so much research on these e-cigarettes, and yet look, what research is there on why is tobacco control stagnating? Almost nothing, because very often the wrong research is being funded, partly because corporations are often driving the agenda. And so a way to shift this industry power is to require industries to make mandatory payments. So, for example, a tax on corporations to fund independent science. We do need a bit more work on the exact mechanisms, but Joanna Cohen, who was speaking to us earlier, and others back in 2009, published a really important paper showing how this could actually be operationalized. And then I think we also need to do training of researchers, public health specialists, doctors, and so on, to really get them to understand the problems of corporate power in science and the problems of conflicts of interest. We've actually developed a new training on conflicts of interest, which we've been piloting in here, and we've just submitted a paper on that for publication. So that's also a work in progress. So we've talked a lot about those other forms of power. We also need to address material power. Okay. So tobacco taxes will help do that. But so will polluter pays approaches. Really, ideally, we need to move towards a point where these corporations that are causing harm are meeting the costs of their harm. And the interesting thing is that if we go back to debates on tobacco endgames, and these date back to 2014, so 10 years ago, the kind of policies being considered for endgame fell into these 4 areas. There has been some movement on these areas, very limited movement, sadly. Smoke-free generation is moving forward in the UK. But the 4th area was supply-side measures. And the proposals here included a regulated market model, removing the profit incentive, price cap regulation to reduce excess profits. So all of these would actually help address industry power, but none of these have gone forward. And I just want to raise for you that these are arguably the most important endgame policies. So finally, this is a slide I use to explore the ways in which we can address the commercial determinants of health. So, and I divide that into 2 elements. So the first I've been talking about to some extent already, addressing the system problem, addressing power asymmetries. We've talked about that. Rethinking political and economic systems. And this is really about moving away from GDP as a measure of progress towards looking at well-being systems, well-being economies, and other ways of measuring progress. Because until we do that, we're really driving the wrong issues. It's also about rethinking approaches to policymaking to ensure that policymaking acts in the public interest. I told you that the tobacco industry and other harmful industries had worked together to push policymaking systems that worked to their advantage. So we need to also think about how do we change the whole system of policymaking so it works more in the public interest. And another key intervention here that we've talked about is addressing corporate influence on science. So clearly this agenda on the commercial determinants of health works very well for tobacco control. And the second key area, which is a sort of subset of the commercial determinants of health, if you like, is around how do we address non-communicable diseases and how do we move beyond what's often referred to as tobacco exceptionalism. And this is really around Article 5.3. And it's about ignoring the now overwhelming evidence that these health damaging industries all engage in the same political practices, they all engage in the same scientific practices. And so we really need an Article 5.3 across all of those industries. And the reason this is important for tobacco control, of course, is that tobacco companies are no longer just selling tobacco, they're selling those other products. And so it's actually a huge advantage for tobacco control if this understanding of conflicts of interest improves, and if these other areas of public health, where there is clearly also a massive conflict of interest between these industries and public health, is better understood and starts to be addressed, that's also going to be really key to progress in tobacco control and will help us or help prevent the tobacco industry from undermining Article 5.3, which is one of the key things it's trying to do. So let me just end by saying tobacco control really needs to harness the commercial determinants of health. Of course, we have to continue those individual fights for each policy, but we also need to think about the long term, and we need to harness this broader agenda on the commercial determinants of health. It will really help us move forward in tobacco control, and indeed, I would argue that it's essential. Thank you.
Such an amazing presentation. You covered a lot of ground in the short time and giving, a really strong foundation for understanding the commercial determinants of health, and then, strategies that we can focus on moving forward. So there are quite a few questions. I'm going to try and jump in and get to as many as we can in the time that we have. So one question is about sort of globally. Have you seen, how would you characterize, are there differences between the tobacco industry's tactics and the role of the commercial determinants of health in low and middle income countries versus higher income countries?
So we have looked, I mentioned that we've developed this taxonomy and model of how the tobacco industry influences policy. And when we did that, most of the evidence was from high income countries. There were some papers from low and middle income countries that were in the systematic review, but far less. So we've done a piece of work since then looking specifically at low and middle income countries. And the short answer is they're doing the same thing. And so the same model applies. But in general, they're more audacious very often in low and middle income countries. So that's the quick answer.
Okay, great. Another question that, in the past, I think when there was a lot of time, at least in the US, that's sort of the area that I'm most sort of knowledgeable about. There was a lot of focus on denormalizing the tobacco industry at the time when, we had the famous congressional hearing where the tobacco industry executives said that nicotine is not addictive, and everyone, anyone who used tobacco products knew that that was completely false. And I think that created a space for, a focus on the tobacco industry. Today, what might be the fuel that we can use to denormalize the current iteration of the tobacco industry, given their products, how they're positioning themselves? Do you see sort of windows, levers that?
Well, I mean, perhaps this whole agenda over harm reduction is actually an opportunity. I showed you that graph on Philip Morris. So they're making these big claims that they've transformed, they're doing the right thing, and yet since they've been doing this, progress has stalled, and you can look, with the data we've looked at is for Philip Morris, but it makes this great transformational claim. And as soon as it makes it, actually, the preceding decline in smoking, in its cigarette sales stalls. So perhaps we can, use the agenda it's trying to win and turn it on itself. The difficulties, of course, they are way better resourced, and we need to sort of bring in some real communication specialists and look at how do we do this? How do we get people to understand what they're really doing? I think also that the targeting of children, what's happening with children, I think can also be really powerful, and they could be a powerful voice in this, and how they're being hooked. But one of the things that I'm worried about is the emerging evidence that nicotine use at a young age can effectively rewire the brain and increase the risk of addiction long term. And it's likely the tobacco industry have known that for ages. So I think that's another area we need to look at.
Thanks. I'm going to paraphrase a question from one of the giants in the field who's listening, to try and make it a bit more global, the question. So you talked about some of the underlying forces that are causing all this non-health, death and disease. And one of those underlying forces is a move towards more sort of neoliberal sort of policies, ideology, et cetera. Do you feel that the solutions or some of the strategies that you sort of talked about in this presentation can address that? Do we try and get to those root causes? Is that really, yeah? So just maybe if you can speak a little more about.
Yeah. Well, the evidence on neoliberalism is quite clear, and there's a couple of really good books on this. That it was major corporations and the very wealthy helped fund and push this drive to neoliberalism. They set up think tanks, global organizations, schools of economics to help drive this agenda. And I think we're seeing some problematic outcomes of neoliberalism, and I think some of those graphs around where wealth now sits are part of that. And there are emerging debates, and this is where I think the wider agenda on commercial determinants of health can be helpful. There are these emerging debates around new economic models, the well-being agenda, the donut economic model. And it may seem pie in the sky now on the day of your election result to kind of think about that, but that in some places those are being given consideration. And it's not always at national level, it's sometimes at local government level. And so I think we need to kind of use any experiments we can to kind of explore what impact that has. At local level here, for example, there are also smaller ways in which that's being taken forward. So in say, using procurement power. So if a local government or any government, they're actually quite powerful agencies. They spend money. So when they're hiring, an accountancy firm, they can hire local firms, or they can refuse to hire anyone that's engaged or enabling tax avoidance. They can insist that they will only fund companies who have an equal, male and female pay ratio, or where there's a limited gap between chief executive and average worker salary. So actually you can start to change norms through some positive changes as well. And I think all of these efforts will help. And I think, there are also huge agendas on the climate. That links really closely with this agenda. And we're quite clear in the Lancet paper that this isn't just about human health, it's also about planetary health. And obviously those two are really one and the same. So I think there are, things are starting to happen. It does sound, some of it sometimes sounds, I think, a bit pie in the sky, but I think people are waking up to the fact that there is this system problem and we need to do something about it, and change is starting to happen.
That's great. So I think that sort of touches on a couple of other questions. And then in terms of, you sort of gave sort of the 4 categories of tobacco endgame, and sort of pointed out that, the supply side box, there's some great ideas. We haven't seen a lot of discussion around that recently. I mean, part of that might be recency bias that, it's been a while, and things,
Yeah.
new research isn't being published or we haven't been talking about it much. And so again, do you feel hopeful? Are there particular supply side policies in terms of thinking about endgame, that either you've seen being impactful, or that you think might be most likely to be that might be possible to move forward with them anywhere in the world at this time?
Well, I mean, the point I was making more that we've almost forgotten that there were those supply chain proposals, and they're the ones that really do give sort of the system change that I would argue we need to think about. I mean, there is interest here in a sort of polluter pays approach, and using price cap regulation. So that is an agenda that's slowly moving forward. So I think there is traction here, and I think the difficulty sometimes is explaining these approaches and the sort of practicalities of how we implement them. And I think one of the other challenges is that I think in research terms, it's very easy to identify problems and research problems. It's actually harder sometimes to research solutions, especially when they're messy solutions. How do you change norms? How do you get people to understand the need for sort of supply side approaches? So I think those are some quite difficult things to move forward. And so there's a tendency to just keep doing, it's so easy to keep saying, oh, the industry is bad, let's look at what the industry is doing. And of course that we need to do that, and we need to let that inform everything else, but we also need to start researching the solutions and how we move them forward. And when we're starting to do that on a grant now, and you realize actually it can be really difficult to do because it's messy.
I know we're at time. I'm going to ask one more question, which probably resonates with a lot of people listening to this, and maybe just on this particular day. But Anna, how do you, given all this, how do you remain hopeful?
I mean, it can be difficult because I think the endless fights can be difficult and they can be wearing. And I mean, perhaps one way I've remained hopeful is thinking that we can go beyond just the tobacco control policies. We also need to address this broader system problem. And you do see, we would, think back, we were told that every tobacco control policy would be impossible. We would never get smoke free, we would never get plain packaging, but we have made enormous progress, and we need to remember that. And we need to remember that these, in these David and Goliath battles, and they are like that, we do often win. So that there is hope, and we need to remain hopeful. And I mean, also because, you know, we've got great colleagues, we work with great colleagues. It's intellectually exciting. There's, you know, there's lots of things to do and move forward. And I think we mustn't forget our successes. And I believe, you know, change is possible. And we need this change at the end of the day. We do need this change.
That's right. The stakes are high, and someone's got to be fighting for the rest of us. So that's fantastic. Anna Gilmore, thank you so much for just a fantastic and for me inspiring lecture, and help sort of level set and maybe, you know, identifies, you know, what some key focuses for the future. So really appreciate you sharing your thoughts so eloquently, and look forward to learning about the work that you continue to do. So thank you so much.
Thank you for inviting me. Thank you, everybody, for coming.